70 to 80% of the kids, they didn't show any hair and nail mercury excretion. Mercury was not found, and they were having a high symptoms of autism. We called it as we divide autism into high grade and low grade, high functioning and low functioning. Low functioning are the most toughest actually. High functioning is getting better as such. So most of the low functioning, slow symptoms, they never used to excrete the thing. There is a process. These children are not able to take out heavy metals by their own. Their detox process, the detox is usually by the skin, it is by the hepatobiliary, it is by the renal as well as the colon. All these systems are not functioning properly. That's the reason they are not able to. Subsequently, there was a study of Emmy Holmes which came, and she was able to show the more severity was there. So what the mistake we did in that first study was, and we labeled you don't have mercury, and I see that kids still into a big problem. 17 years old, 18 years old kids, and they are not functional, they are not independent, etc. So as a radiologist, I went ahead. What will be the features on MRI? MRI, we had some of the reports were there as well. I didn't find any case of this. Few of my cases whom I subjected. I subjected somebody from having a fix to MRI, and it's very nice. It is all in the literature. It is written as well. Next slide. In the CT scan also there can be enlargement of ventricles, which is hydrocephalus, and parenchymal lesions as such. Next slide. This is a very important test which is called SPECT scan, and Dr. Kumareshan is one guy who has kind of helped us as such, and we did some studies with Richard Fry also. There is a certainly mismatch in the perfusions in the both lobes, particularly temporal lobes are slightly metabolically low when you next slide. PET scan definitely gives a lot of this one answer, but as a parent, as a doctor, I can tell you there is no test which can definitely prove that it is autism or it's not autism. You have to definitely depend on a lot of history. Try to go with what are the things with the child has got. Try to look at the MDHFR and next slide. These are the few of the cases where autism and that is the control actually, and it showed in frontal areas there is increased activity, whereas in the most common thing was the reduced activation in left dorsolateral prefrontal cortex, which was near to the temporal lobe, and it is basically hippocampus, amygdala, and mammillary bodies. This is the area I can show that particular corner. This is the area which is hyperfunctioning as well. It is a hallmark of most of the autism cases. Next slide. EEG doesn't give us any good use as such because it's not a very standard this one. People in US they have done a thing called MEEG. That also is a one more add-on where they are looking at the frontal sulci and gyri also. They are able to do a whole this one, sir. What happens is that when we are doing a EEG, we have a sulcus and gyrus, and we are missing that particular part. So, so MEEG also was postulated, and we know this child may go for fits and all that, and we can always do some remedial actions. Next slide. This is the thing I said. I was, as a mainstream doctor, I thought, okay, I know everything. As a radiologist, I used to have, I had a very good, Aditya, I did a very good cases in Aditya, sir. Dr. C.M. Prasad, all of us, basically. So I used to think that I know. So what I need to think is, next slide, there has to be a research. And recent study has shown many of the children have coexisting medical conditions that needs to be addressed. And it may sound alternative to a few of my family doctors. My cousin brothers, he said, "Are you doing some alternative?" I just kept quiet, let me do, if it is helping my kid, let me do something. I don't care about that. Next time. And despite a lack of evidence-based approach, I did stumbled upon cutting down the mill, and it gave me the result immediately. The moment I cut down the mill, the hyperactivity, jumping, everything gone up. Then I started reading what Paul Richard has to say. Paul Richard, there are some people who have done work as such, and they said the child with milk, he is making casomorphin, and he is acting as a morphine addict, and they were able to isolate opioids from the urine cell. Opioids are formed from gluten and casein. Gluten is from wheat, casein is from the milk. So the moment you cut down that, it's most of the aloofness, he doesn't want to get involved, he's in his own world, that started coming down. His GI, I have seen like other patients also, 3 days, 4 days, no bowel movements. The moment you cut down this milk and this one, things get better. So all these things we started maybe experimenting, because we thought there is no other go action. Yeah, we need to, it's a highly individualized treatment and every child requires a different answer. I definitely feel that there are some parents sitting here as well, and I thought, let me empower them with the knowledge, and they are our best, their own case managers. They start reporting every stuff, because unless I know what is the having, how the child is behaving, once the parent tells me, then only that. So we used to do some documentations also, man. We started doing some paperwork also. We gave a 19 pages questionnaire pre, and during therapy also we used to ask them to fill some other pages and all that. So it made us more confident. Next time. Yeah, this is what exactly. I was, in fact, in the early 2000, I was taking my son to Delhi. I never, I can be very open here. We look into every occasions, everything and all that. And the society was really very, very harsh. Arey, bachcha to pagal hai. They used to tell like that. So I somehow believe that we are not going to get affected by any of this. Because what happens is, you think it's only one particular thing, and you start hiding your kid. I had seen one of my relatives hiding his kid, chaining him inside. He doesn't allow this kid to come out. So we are not doing justice to them as such. And somewhere a thing like autism, it requires more human approach. So the thing is, yes, it is basically a kind of significant elevated levels of antibodies. Everything is there as such. It's there on the net, it is there in the studies and all that. Now we understand it's a medical disorder. It's a whole body disorder. And it involves immune system, it involves GI system, it involves endocrines, and it requires neurology. I'm happy a dear neurology student is here, Manas. Next slide. This was the work which was done by a great doctor who is called Dr. Andrew Wakefield. He presented a paper in the Lancet. He did scopy study. He did colonoscopy of 8 kids, and he found lymphoid nodule hypoplasia, and he was able to find out measles into that. And he was able to pick up the measles strain which was there. It was of the measles vaccination strain was there. And he put out the paper. He had a big problem. Subsequently, he has to leave UK. Now he is practicing in US, and he has gone much further as such. And it was his study is a very important study, because he was the one who showed the path basically. And Dr. Madan, what happened was at that time when endocrinology paper came, it was Tony Blair was the Prime Minister. He didn't give MMR to his kids. What he was telling, don't give him, try to give it into parts and all, something like that. Try to give some gaps and all. So that was followed that one. Next slide. This is one thing which we very common in all the children, which is called PSD intolerance. And for the same reason, phenolic foods are being avoided. Phenolic foods are usually apples. The autistic kid apple, and you start he will get hyperactive. His ears become red also if he is a red complexion. So all these things will happen with that. They start glutathione peroxidase and SODs, superoxide dismutase. This is the important antioxidant mechanisms, and these are also found very low in almost all autistic. I can say even the parents also. Glutathione. I found myself to be glutathione. I found there was some low level, and I try to take now a lot of NACs, try to work with some kind of keep my liver clean and all that, so that I have a abundant enough glutathione. Next slide, please. I have learned a lot by treating autism kids. My health also improved. It is someday I must say because this was not taught to me before. I was not aware of the food allergies. Now I believe that if I take that kind of food, I'm going to get a problem. I become hyper. So I try to cut down that particular stuff. Yeah, next slide. So this is what I was talking about jail. Next slide. This is over. Next. You are aware of the gluten sensitivity and the opioid access theory. Next slide. Sulfate is one thing which we try to work it out. Sulfate is the major problem. Sulfation is the major issue which gets broken because of the toxicity, and we try to replete that particular thing by doing some other stuff. There is a thing called Maxel, and we work on some other areas, trying to give magnesium and all that. All of my patients, including me, we start supplementing magnesium on our own, sir. And it was one thing which I found in my practice. I do get some patients who are having a ischemic cardiomyopathy. I have a lot of patients with CADs who come after bypass and after stenting. I do something called ECP. I do kinesiotherapy. The thing which helps me in my patients is I try to correct their magnesium levels. Magnesium is unfortunately not absorbed orally. It is not absorbed orally. It has to be given transdermally only. We give abundant magnesium. The kids, if they are using proper magnesium gel, we give in the form of a gel. They start behaving very well. And most of my other patients, I see there is a epidemic of low magnesium in the current day. Even a diabetic also gets help. You improve the magnesium levels, you see the difference. Next slide. Over a period of time, I started looking at what is this insecticides, herbicides, mercury, automobile fumes, household things like cleansing agents, formaldehyde. Formaldehyde you get from the new furniture. New thing, whatever, you take a new shoe, it bites. A new furniture you take is going to help. I'll tell you again, maybe I don't talk this much when I talk to you as a person, because we have 5 minutes or 10 minutes only. Whatever mattress you are using, don't use that foam mattresses and all that. Foam mattresses, they start emitting formaldehyde and PVDs in that. There was one company in US, he came to autism conference and he sponsored one particular thing, and he said cotton is the best. It is in Colorado Springs actually. So we had to go to Colorado Springs, and we don't want to listen to our grandmother who has been always telling use a cotton mattress. So I immediately changed my this one, because the child is lying on the mattress for more than 12 hours, and it is found that this particularly ethers and things, they keep outgassing. They keep on PVDs as well as formaldehyde. And in the new furnitures, they outgas things. Even the carpets what we use, we have to be careful about that. Next slide. So again, I'm just trying to make both biochemistry physiology, you to understand these two things as such. Oxidative stress, I can tell you only one thing about oxidative stress. I keep talking in various forums. I am talking in public as Walker's Club. I have given 3 talks there. Stress. Everyone is full of stress. Somebody has stress with his boss, somebody has with his wife, somebody has with his subordinates and all that. I'm not talking about the stress. I'm talking about the oxidative stress, what your liver is having. You have got a lot of free radicals inside your body. And your body is working really overtime to quench that free radicals. And you are not a smoker, you are not an alcoholic. Still, if we happen to go around Bashirabad Road, we are definitely getting into high free radicals. Sometimes it is one thing. So this oxidative stress, how do you work on this oxidative stress? And if I am able to reduce the oxidative stress with the process, with the food modifications, with some kind of simple therapies, like take normal good water, find good oxygen. There is a doctor in other part of the Delhi. He gives only oxygen for 2 hours for a patient. Only oxygen. And it works. We have done some hyperbaric oxygen and all that other things, but it do matters to us. There is a difference also. Because what I believe is, in that part of North India, Delhi, you don't have proper oxygen there. Whatever metro cities in Hyderabad, Dr. Manas, do you think what is the present level of oxygen in cities as such? I have read in my, see, I am 51 now. I have read in my 10th class, 7th class, that 20% oxygen is there in the atmosphere. Do you think it's a 20% oxygen? Less than 11% is there. Delhi is more worse. So, good things that we can start putting a lot of oxygen bars. Next slide. Due to the extreme variability of this disease, each child will require different treatment plan. I think I have made it amply clear about that particular thing. And the next slide. What to do? We need to review the evidence linking individual genetic susceptibility and toxic inserts. I will be talking about genetic susceptibilities because Indians as a whole are being told, yes, I have got, my dad has diabetes and I am into diabetes, and he's shameless. Somebody comes to me and asks me, yes, doctors, I have got from my father as such. I keep asking him, probe him, when is your grandfather got diabetes? Late Dr. Garvit wasn't, he at the age of 65, 70 he got diabetes. And what about his father? He says around 45, 50. And this chap gets at 30. So if it has to be only genetic, he should get only at 65 or 70, not at 30. So there are a lot of environmental variables also, and we just can't tell that we are genetic susceptible and we are the setting targets. We have to wake up. We can't. That's how things are happening as well. Yes, I want my mother had or my some aunt had breast cancer, so I also got it. This is not the answer actually. You have to be proactive, like work with some other things, and we'll just discuss about autism, discuss biological treatment approach to autism, and medical, legal, social barriers are we have discussed. Next slide. Autism is genetic susceptibility plus time-sensitive toxic insults. Genetic susceptibility, I mean MTHFR, low kind of glutathione is genetic susceptibility. And over that, you get some inserts, you are getting into a problem. So we need to screen the people who are having that. Next slide. The next slide. So impaired MTHFR, COMT, and methionine synthase, and these are all these things. GSTM is one more thing which is very commonly found in all Indians actually, and we have an impaired GSTM action. Next slide. So there are studies. Identical twins both have autism, unlike fraternal twins, and 20 or more genes may be associated with autism. And we were able to SRL Ranbaxy came into picture, and they said we'll also do some genetic studies and all that. And There is still a study being done for Indian kids, what makes the Indian kids more susceptible to autism, and parent with one autistic kid has increased odd chances of future children having autism. This I can talk in later as such. Next slide. So it is the genetics which load the gun, but environmental tools will be there. You have genetic predisposition, but you have some, if you can control your environmental variables, we can prevent that problem. And autism has increased, you are all know. Now the picture in Hyderabad and metros is 165. 165 is the autism incidence. Because all the things, schools, these people are not allowed in the schools. So no question of getting a census from the school, you have to depend on the other thing answer. Next slide. Yes, this is one thing. Suspected environmental cause are childhood vaccines which can compromise immune system. Thing is, what I went across, I am sharing all these things. It has not been totally proved. Only thing, what we feel that yes, I would not have given that particular vaccine of MMR or DTP when he had the fever. So it is somewhere, it is a kind of still there is a lot of it's a debate. And yesterday also there was a truth about vaccines. There was a documentary which was shown by Ty Bollinger. Ty Bollinger gave a documentary. There were 7 studies that were done. I happened to listen to all these things somewhere, and I was appalled. A smallpox vaccine which was given resulted in high levels of tuberculosis. Now I understand why tuberculosis is more in India. They have done a correlation, sir. Now they are saying this smallpox vaccine, giving smallpox vaccine can make the person susceptible to tuberculosis. It is one of the things I found out yesterday only. This is thimerosal in mercury was the culprit. Thimerosal was added in the vaccine to increase the shelf life against the antibacterial, antifungal things as such. And this was done in 1930s. There were no studies were done. This was the only exception as such. And in 1991, hepatitis B was introduced in California. By 1994, they saw certain increase in cases of autism by 600%. It was almost 600% is a jump as such. It took 6 years in a country like US to understand what is happening. So by 1991, hepatitis B shot was introduced at birth. 1993 or 94, they were able to see some jumping cases. By 1999, IOM and AAP gave a directive that it is plausible introduction of this particular hepatitis B. Hepatitis B problem was it was having high levels of mercury, which is thimerosal. And they said we will discontinue this process. I can tell you, in a country like US, and the directive passes from 1999, it took till 2007. By 2007, all the mercury in the hepatitis B was phased off. All the mercury. And in a country like US, it took so long time. And I don't understand how 10 years back, there was a foundation, big foundation as such, the Melinda Gates Foundation. They said we are going to vaccinate the whole Kakinada or Anantapur and all that with this hepatitis B and all that. So I'm slightly, I think the motives are not very, very clear as such. You try to phase off this one, and I in fact went to CDC. I had wrote Jacob Pulier and myself, we wrote something to WHO. He said, yes, it is possible for countries, developed countries, US and Europe. For India and developing nations, developing countries, you still have to follow this thimerosal vaccine. And we are still following it. Very few doctors are writing thimerosal-free things as well. But whatever you are getting into that UIP program is all full of mercury. So I somehow, maybe this was one thing which I feel we are it's not proper. Something is because I can understand the pain what I have gone through going through one autism kid. First of all, the diagnosis as a medical doctor, it took so long for me to understand all that. What will be the plight of the normal people? They will not understand. They're just dumb.